Welcome to our animal hospital. We're so happy to have you as part of our team. We wanted to talk to you today about safety in the veterinary hospital, particularly as it pertains to radiology, controlled substances, patient exam rooms, inventory, kennels, and the surgical suite. As far as radiology goes, excess radiation exposure can lead to birth defects, decreased fertility, and cancer. Therefore, it's very important that everyone must wear PPE, personal protective equipment, at all times when taking radiographs. This includes lead aprons, thyroid shields, and lead gloves. Dosimeters should also be worn on the outside of the apron at the collar to track radiation exposure, the maximum of which is 5 REMs per year. Improper use of PPE can be grounds for immediate termination. It's important that you minimize hand-holding as much as possible. To do this, you can radiograph anesthetized patients so that team members don't have to be in the room during the exposure. To do this, you could use rice bags, sandbags, ties, and tape to securely position an anesthetized patient for the desired view. You should also minimize scattering radiation by removing the patient's collar and collimating the radiograph as much as possible. PPE should be checked annually for any cracks in the lead. If cracks are found in the PPE, the item should be disposed of immediately and you should replace it. To prevent cracks from developing in your PPE, you should avoid folding gowns and thyroid shields, and instead lay them flat or hang them. Safely handling controlled substances is incredibly important in the veterinary hospital. With all drugs, but especially controlled substances, you should do a single-handed recap of your needles to prevent accidental sticks. Signature cards are required to be kept on file for all employees with access to controlled substances so they can be compared to the logs. All controlled substances must be kept in a securely locked, substantially constructed cabinet or safe, and records and invoices must be kept for 2 years for inspection. Schedule 2 drug logs and invoices must be kept separate from Schedule 3, 4, and 5 drug logs and invoices. Drug logs must be kept for all controlled substances and must include client name, client address, patient name, reason for use, amount of drug administered, inventory of drug after use, and the initials of the person accessing the controlled substance. Inventory logs should also be kept for all controlled substances, and they should include the product name, strength, and amount in a full bottle, the date of purchase, the name and address of the vendor, the date and time of inventory, log quantity, physical quantity, any discrepancies found, and the initials of the person doing the inventory. Before administering any drug, but especially controlled substances, check to make sure it's the right drug, right patient, right time, right dose, and right route of administration. Theft or loss of drugs should be reported to the police and DEA immediately, and expired controlled substances should be incinerated or placed in drug neutralization pouches.
Now I'm going to talk to you a little bit about patient exam room safety. So, when putting an animal onto the exam table or even just lifting an animal in general, always lift with your legs to prevent injuries to your back. Policy is that all animals over 40 pounds should be lifted by at least 2 team members to avoid injury. If you mop for any reason or the floor is wet, you need to put down a wet force line. If you have secondary containers for any liquid such as alcohol, you must label it correctly according to OSHA. Needles, glass slides, surgical blades, and cover slips are all considered to be sharps and must be disposed of in an appropriate sharps container. Do not, under any circumstance, let a client or owner restrain their own animal. This can cause the animal to react in a way they may not normally, and it will be the fault of the veterinarian. Any accident that occurs must be reported to a safety manager. The computers or the computer system should be locked when not in use. Properly clean the exam room in between patients with the correct disinfectants. Now for inventory room safety. Always place heavy items on lower shelves. Always place any chemicals and liquids on lower shelves. Any chemicals need to be below eye level and in tightly sealed containers if they were to spill. Shelves should never be overweighted with products so that they do not fall. If you need to get a product from a tall shelf, always use a step stool. Never climb on the shelves as this can cause the shelf or products to fall and injure you or a team member. Lift items with your legs and not your back.
Now I want to talk to you about the kennels in our hospital. The kennels are where we house sick and recovering patients from surgery. They need to be cleaned after every patient, so you can use rescue spray and paper towels or wipes to wipe down each cage. It's important to let the cages dry before you introduce patients into them because there are chemicals that can be harmful. If you need to refill a spray bottle, make sure to include a label so that everyone knows what's inside of it. When walking patients from kennels after surgery, be sure to use a slip lead so there are no escape attempts from animals and to make sure that they're safe from other animals. You should never have two patients interact with each other because there can be deadly consequences if they don't get along. Now let's talk about the surgical suite. This is where surgeries are performed by the veterinarian. It's important to keep the surgical suite clean so that you don't break the sterile field. This includes mopping and sweeping at the beginning of the day and after the end of all the procedures at the end of the day. You should remove all of the instruments after surgery is completed to be clean, and be aware of sharps such as needles and scalpel blades should be put in the sharps containers. The surgical table should be cleaned after each patient and at the end of the procedure. Be aware of wet floors after mopping. You should clean the monitoring devices after the procedure so that they are not have any of the other patients on them. You should be aware of the anesthesia machine and check for leaks before the procedures are performed, and so you're not inhaling any of the anesthetic gas yourself. And you should always check the oxygen tanks before the procedures start to make sure you have enough oxygen for each procedure.
We're so excited to have you as part of our veterinary team. If you can't remember anything we've talked about today, or you need further information, you can always check the safety manual, where we have all the information that we've talked about today and more.